being made. And when you don't have enough beta chains, you have imbalance between the number of alpha chains and the number of beta chains, which you were just talking about. And when you have that imbalance between your alpha and beta chains, extra chains get deposited on the red blood cell wall, and the red blood cell breaks.
So which causes the loss of blood?
Which causes your red blood cells to be destroyed prematurely. Normally your red blood cells, sorry, I'll just take your question in a minute. Normally your red blood cells survive for 120 days. But when you have the disruption of the outer red cell membrane, then they may actually die within 30 days or maybe earlier depending upon the severity. You had a question.
Is this genetic or is it mostly environmental?
No, it is genetic. It is a genetic disorder, and it's usually spread through families. And we'll talk about how it's spread in just a minute. Wonderful. I'm so excited about all the really good questions which you guys are asking. So kudos to you guys. What else?
So I heard like hemoglobin basically it makes your blood red, right?
Yes.
So like if we don't have enough like proteins in our hemoglobin, what does that have to do with the color? Does it make it more dull or more light?
Light. So when you don't have enough red blood cells in your body, your oxygen is not getting to the places where it should be.
Oh yeah, that
Because-
makes sense because hemoglobin is dark as well.
Right? So if you think about it, what does the red blood cell do? It actually carries oxygen from your lungs to other vital organs of your body, to your tissues and other places. And so if you didn't have this, or you don't have enough of this, then you're going to stay pale. And when you stay pale, you're not getting enough oxygen to even your brain for that matter. Question over there? Yeah?
What about the alpha gene if it's not in the perfect number? What if it's more than 2 or less than 2?
So this is an example I gave you more than 2. Actually, you have 4 alpha globin chains. Then you have alpha thalassemia. Alpha thalassemia is less common. I shouldn't say less common. It is more common than beta thalassemia, but it is less symptomatic. So it doesn't affect your health as badly as beta thalassemia. So, yeah, go ahead.
So beta thalassemia and alpha thalassemia are different kinds of thalassemia.
Yes,
And they have
they are.
different effects on our
Yes, yes, they do.
What's how?
What's it?
So one question here, and then I'll come to you.
How many types of thalassemia are like known to like till now?
That's a lot. I'm going to start boring you if I tell you, but you have alpha thalassemia, you have beta thalassemia, then you have non-transfusion dependent thalassemia, you have transfusion dependent thalassemia. But we'll talk about that.
So like these are like the minor types which aren't really like that common.
They are common, but they're classified in different ways depending upon the severity of the thalassemia. So if your gene mutation is a mild gene mutation, then your disease won't be so severe. But if that same genetic mutation is a severe genetic mutation, then it will be a much more severe disease.
Let's listen more about it. What causes it, and how can we?
Yeah.
And then you can move on to questions after that.
Perfect. So let's talk about how it's spread, because we were talking about prevention and how do we actually prevent it. You can only prevent it if you understand how it's spread. So like I said, it's a genetic disorder. It's spread through families, right? Now we all know, each of us, when we're born, we get one part of our genes from our father and the other from our mother, right? So if both of them are thalassemia carriers, so I have one chromosome over here, one chromosome over here, same here. If this chromosome, my chromosome 11 here, has a genetic mutation for let's say beta thalassemia, and the spouse, or if this is the father, this is the mother, also has a gene which is affected, has chromosome 11 affected or beta thalassemia, this is typically called a thalassemia carrier. So because of this affected only one gene, the normal gene will take over the function of the body. And this will not affect this person's health. But what happens if when they get married and they have children, there's 4 possibilities. One possibility is the affected side comes in contact with the normal side. So you have the affected side and the normal side, right? That's one possibility. You have the normal side coming with the normal side. That'll be totally normal. You have the affected side coming in contact with the affected side. That's your thalassemic patient, or what we sometimes call thalassemia intermedia or thalassemia major. And the 4th possibility is you have the affected with your normal. So again, I'll put that as circle, a thalassemia carrier. Does that make sense to everyone?
Yes.
Right? So this is in each pregnancy. This does not mean that if you have one thalassemic patient, the rest of them will either be carriers or a normal person. But this will happen in each pregnancy, yes?
Is the first option considered normal?
Yes, they're also considered normal because their health is not affected. If I give you a rough example, the gene frequency in Pakistan is about 5 to 7%. So that means if there was 100 children sitting here, there's a possibility that 5 out of those 100 would be a thalassemia carrier,
They are carriers, yeah.
right? But they wouldn't know it because it doesn't affect their health.
Can we identify whether someone is thalassemia carrier or not?
Yeah, absolutely.
You're probably going to have
Simple.
to take a DNA test.
Not a DNA test, it's a simple hemoglobin electrophoresis test. Sorry.
That was happening.
It's simple for me, but maybe not. What it is, it's a simple blood test. It's not necessarily looking at the DNA, but it's looking at the different type of proteins which are present.
Oh yeah, that makes sense. Like, so basically you get like a blood sample and you check the hemoglobin.
Exactly.
How many proteins?
Well, not necessarily just the hemoglobin, but what type of proteins, right? And so it's a pretty standard test which you can do to find out if you're a carrier or not.
Is it expensive?
So I'll tell you something interestingly. The Punjab Thalassemia Prevention Program does it free of cost.
No, that's the point.
And it does it across all 36 districts in Punjab. It's not a nationwide program currently, but it is present in Punjab. And what they also do is prenatal diagnosis. And so I'm going to go to that next. Now, so one scenario is if both of them are carriers, right? What about this scenario? Will you get these 2 people got married? Are they at risk of having a thalassemic child?
A very small risk.
Very Hold on. Let's answer this and then I'll come to your questions. So, this person's totally normal, does not carry a thalassemic gene. This person does. Are they at risk of having a thalassemic patient child?
No.
No. That's how you prevent.
They can have a thalassemia
Carriers.
Yes, excellent. So they'll have a thalassemic carrier, right? But not necessarily a child.
But
Yeah.
what if there is a thalassemia patient and a normal person?
Oh, perfect, excellent. And I have examples of that. So you have a thalassemic patient and a normal person. Will they have a thalassemic child?
Well,
No, they just have carriers.
Doesn't it like depend? Because sometimes like you don't know, your genes are basically randomized, and like you have no idea like if your child is going to have like he's probably going to be a carrier. He could be, or then he could be a patient as well.
Could he be a patient in this case?
No, but like the child. Could
Yeah, I'm talking about the child.
Yeah, I mean.
It'll be the child of these 2 parents, right?
Wouldn't it?
No, that's okay. But I want to understand your question.
I'm kind of confused.
That's okay. Let's help you here. So this is the scenario, right? You have a thalassemia patient, you have a normal person. The only possibility in either of this case is a carrier, right? So all their children will all be carriers. All of their children only be carriers. They won't be a thalassemic child. Yeah.
Does the type of thalassemia that the parent has affect the type of thalassemia that the child would have?
Yes. So just to give an example, well, just to throw another complexity into the whole situation, there's more than 200 known genetic mutations for beta thalassemia. And in Pakistan, there's 13 different genetic mutations for beta thalassemia, which are common. 200
And
Out of
plus across the world. And in Pakistan, we know of about 30, which are common but out of those 30, 13 are common. And that's where you do a DNA test.
But like, how many percent of Pakistanis have thalassemia?
27%.
Okay, so if we talk about a carrier, remember I said 5 to 7%?
But like, what about patients?
I'll get to that in a minute. Ji, please.
Sir, you are making the circle and one's shaded, one is not shaded. So the possibility at the end, you made some drawing at the end.
Yeah.
If two carriers,
Ji.
one male, one female is got married and then they are producing something. So that will be the purely thalassemia patient or
First
See,
analysis.
ये वो वाली एग्जांपल है सर कि अगर दो पेरेंट्स दोनों कैरियर्स हैं
अच्छा, they have a positive and negative side या alpha beta like something?
नहीं पॉजिटिव नेगेटिव नहीं है आप समझे कि या तो वो थैलेसीमिक म्यूटेशन है या नहीं है
दोनों कैरियर्स हैं, पेरेंट्स दोनों कैरियर्स हैं,
No,
खुद
I'm
पेशेंट्स नहीं हैं.
I'm actually learning about this shaded region. You shaded one left side, the other one the right side.
that was just by chance
Okay.
वो आप इस साइड को भी शेयर कर
Because
सकते
I'm a mathematician, so I'm talking about exactly.
वैसे interestingly despite the fact that I'm a doctor A levels में मेरे मैथ में A आया था और बायोलॉजी में B आया था but so I respect your mathematics but ये तो सिर्फ इत्तेफाकन मैंने ऐसे बनाया है but it could be either way that this just indicates that one gene is normal and one gene is affected.
No, actually I'm thinking about if both are having left side.
That they can have a thalassemic child. If one is normal and one is a thalassemia carrier, they'll only be carrier or normal, right? And if a thalassemia patient with a normal person, again all carriers.
What if both are the patients?
Well, if both are thalassemic,
Obviously,
then
your child will also be
their child will have
But
thalassemia.
if they have both have different types of thalassemia, one has alpha thalassemia and one has beta thalassemia, then which one would be the major one?
So now let's throw another complexity into the thing. Remember we talked about severities? Some gene mutations are more severe than others. So like I said, we know of 13 common genetic mutations in Pakistan, which do cause thalassemia. We also know that out of these 13, some of them are more severe. So I'll just give you an example. Ignore the language of it, but you can have IVIS 1 to 7, right? That's a type of genetic mutation. Just ignore the language for a second. Or you can have frame shift 8 and 9, right? Now, if you have if the child who is born has two different types of thalassemia, like you said, so he has this and this, these are two different types. It also depends how much of this is expressed and how much of this is expressed. And so it's not so mathematical that you can
whichever
actually
is stronger.
estimate. Right. And the expression of the gene will be depend on a lot of environmental factors, right? It's just like, I'm going to use a very crude example. I may have a gene which predisposes me more to diabetes, right? But if I take care of my health, I may never present with diabetes, right?
Isn't that make it like a borderline patient in this disease?
Not necessarily. If I take care of my health, even though I have a genetic mutation which predisposes me or puts me at a higher risk of having diabetes, but if I take care of my health, then I'll be fine.
So is there any resistance power in between all these cells that sometimes they can prevent us from this disease?
They will not prevent you from the disease, but they will shift you to a milder form of the disease. अब वो जिंदगी में कोई भी चीज 100% zero नहीं है और 100% भी नहीं है. It's always shades of gray. Yeah.
So,
I'll come to you in just a minute. I'm sorry.
drifting off into a different direction.
No, please.
No, we're not.
No, go ahead.
Could you please tell us, because it's now common that first you're getting genetically tested, like parents, and then you have a choice of getting test tube babies, or what we call IV babies. So is that a way of preventing a thalassemic child?
So I'm going to come towards that in just a minute. Just hold your horses right there. You had a question.
If a thalassemia patient and a thalassemia carrier have a child, how percent of the chance is there of the child to get thalassemia?
Almost more than 50%. Now, could you just hold your question for a minute? Because I just want to get to what Hashim was asking
Yes.
about.
Let's move on to the next stage and then, just
Yeah.
ask your question.
So, now here's the situation. We said in the beginning that 5 to 7% of all Pakistanis may be thalassemia carriers, and most of us may not know, right? Let's suppose today we get married. I don't mean we get married, I mean two individuals get married, right? They don't know whether they're thalassemia carriers, right? They find out after marriage or before marriage, या मंगनी की टाइम पे या कुछ और टाइम पे कि they're both thalassemia carriers. Now they know that have a risk in 1 in 4 pregnancies. In every pregnancy, 1 in 4 they have a risk to have a thalassemia patient. How do you prevent that? Go shadi, ye shadi nahi ho sakti.
Exactly.
No, you don't want to say that. Because there is another option, right? The other option is genetic prenatal testing. So what Hashim was talking about is prenatal testing. So what you do is, we know the fetus starts growing, right, in the uterus, and we also know that we can actually check those fetal cells for its genetic makeup.
So we can check before it's born that does it have?
Way before it's born. Because interestingly, in Pakistan, being an Islamic country, there's a fatwa which is used, which was actually issued in Egypt by Al-Azhar University. It is used in the UAE, the same fatwa, and it's across many different sects, regardless of what sect it is. That there's a very strong understanding that जो रूह डाली जाती है ना वो 120 days के ऊपर. So about 120 days of the pregnancy, रूह डाली जाती है, ठीक है? And so if you identify a health issue, either with the child or the mother, before 120 days of the pregnancy, which is approximately 17 weeks of the pregnancy, it is not a sin to actually terminate that pregnancy. So now the important thing to know is that we have to do that test well in advance of 17 weeks, right? And what they simply do is take a small sample, they put a needle in, and they take a small sample of fetal cells. At around 11 weeks of pregnancy, it's relatively safe, and they actually check that fetus's genetic makeup. And if it is a thalassemia carrier, if thalassemia patient, then that pregnancy is terminated. If it's any of the others, the pregnancy is continued.
Do the parents get to choose if they want to terminate it?
Absolutely. It's always the parents' prerogative to decide on what they want to do or what they don't want to do. Nothing is enforced.
And even right before that, I mean, we need to avoid that as well, that it would be a good practice to get the
5 to 7% of thalassemics are actually, of the Pakistani population may be carriers. What that means is 93 to 95% of everyone in Pakistan is normal. Doesn't that mean that? Right? How many people would think it's smart to get everyone tested?
Very
very smart.
It it wouldn't be smart. It would not be a smart way of actually checking it.
It's a very expensive.
Absolutely. But now let me give you a better option. If you know of someone who has a thalassaemic patient in their family, or a thalassemia carrier in their family, in that extended family come up with mamu, khala, pupi, etc., dada, dadi, etc. Thank you. Right? What that means in them, the gene frequency in that extended family is 33 to 66%. So what that means, every second or third individual in that family would be a carrier. So it makes much more sense if you actually want to advocate testing, you'll be to this group. And what has also been seen, and I'm a poor, don't rank me for geography, but if this is Pakistan, again, don't rank me for geography, but there's small pockets of thalassemia. And these are concentrated pockets, right? So there may be regions or pockets where there's no thalassemia whatsoever. And then there'll be families, like we see it more in Balochis. We see it more in Pathans. We see it more in South Punjab. And the reason being is they're more likely to get married within their extended family.
Repeated
Exactly.
cousin marriage.
Repeated cousin marriages. Does that make sense?
Yes.
Yeah, meaning the percentage of thalassemia patients is increasing day by day.
Yes.
Due to cousin marriages and the marriages are kind of though.
Huh.
So here's my other question to you guys. Should we cousin marriages now? You get a check?
Yes.
How many say yes? How many say no? प्यार तो अद्धा होता है.
We can work around it.
We can work around it. But here's my thought, and this is what the Thalassemia Federation also believes in. Remember, we have no right to tell anyone who they should get married to, right, and who they should not get married to. But we have every right to make sure that they're well aware of, if they get married, what options do they have, and make sure those options are freely available. And that's what the Punjab Thalassemia Prevention Program does. Actually, they do prenatal testing free of cost, and if required, they do that fetal sampling free of cost.
It's a big service.
It's a tremendous service, right? And actually, worldwide, considering the population in Punjab तकरीबन आधा पाकिस्तान है ना, population-wise अगर देखा जाए, right? It's the largest thalassemia prevention program in the world right now, because it's running in all 36 districts here.
Apart from this, apart from preventing it, isn't there another way if the person does is a total complete patient of
Oh yeah, absolutely, absolutely.
It's curable, like it has a cure.
So we'll talk about that in a minute. Any questions about prevention? Any more questions about prevention before I move on to the treatment aspect?
So like before getting
One here.
married, so like shouldn't we get checked to see if we're carrier or not? Since like it would be much safer. for us.
So if in your family, it is an excellent idea that if I have the resources, I would want to get tested. All I have to do is just get a simple blood test. If I have the resources, I would definitely get it tested. And ideally, that's what we advocate. That if you have the resources, then everyone should get tested because you want to know whether you're a carrier or not. Do you need to get your spouse tested? Maybe after marriage, yes. Shadi se pehle, mangni tootna chahiye. Right? But again, there's social aspects of what we need to consider as well.
It's very important.
Yeah.
It's very important. If there's 20, 25, 30 young girls sitting here, I guarantee you half of you guys are anemic. Yeah? Right? And so it may be dietary choices, it may require supplements or others.
So what about hair transplant?
Are you looking at my hair and saying that?
No,
No, that again can be genetic and it can be the lack of some minerals.
mostly it's the lack of zinc.
Not necessarily, you can have the lack of copper.
Sarah, like, what about, I'm going off of like the topic here, but like, what about if
That's okay, while I'm erasing this, you can
Yes,
go off the
go
topic,
ahead.
and then I'll come back to the topic. So, ask your question quickly.
So what about like when your hair turn white with like less iron, do they lose melanin or something? Because melanin basically colors. It's color.
Again, a simple answer to that, it's more genetic than anything else than environmental. Okay? Now going to the disease, right? One thing we know, our red blood cells in thalassemia get destroyed quickly, right? We talked about the spectrum. So not everything is gray. You may have mild disease, you have moderate disease, and severe disease. Typically, the severe disease is called thalassemia major, right? The moderate disease is called thalassemia intermedia. And in Pakistan, more common is thalassemia intermedia, not necessarily major. And so what that means is these people need regular blood transfusions. They can't live without blood. So they'll need frequent regular blood transfusions. Along with blood going into, so you get your own blood, but along with blood, the body gets a lot of iron, right? And so you have to remove that iron. That iron has to get out of the body. And that's why you need medications for that. Meds. The other thing, if you do not get enough blood, then your body tries to make more blood. Now, what part of your body makes blood? Bone marrow. Not the liver. Normally, jigar khoon banata hai. Jigar koi khoon nahi banata.
The heart pumps.
Heart pumps blood, but your bone marrow makes blood. So your bone marrow makes blood, right? So what happens is, as the body tries to make more blood, this bone marrow starts expanding. So that's why the skull may actually start expanding. The bones become very brittle, and they may break easily, right? So they get bony changes as well of their jaw in that case. Now, if we do not treat this extra iron, this iron starts getting deposited in different organs. So it starts getting deposited in your heart, it gets deposited in your endocrine glands, and your endocrine glands are your pituitary gland, it could be your adrenal gland, it could be the ovaries, it could be the testes, it could be your pancreas, right? And so these patients all can actually develop diabetes much earlier. They remain short because the growth hormone is not being released. They get the thyroid affected, so a lot of problems. They may not hit even puberty. They'll be 25 years old and they'll be this tall. Right? Okay, so now what's the treatment for this? Give them the blood they need, get rid of the extra iron, and they'll be fine.
2 processes are due.
Right? Now, last thing I'm going to talk about, and then I'll leave it open for questions, and so that we're on time. We know that bone marrow makes blood, so why not change the bone marrow? And that's what's called bone marrow transplantation. Right? Now, how do you do bone marrow transplantation? Well, if I was getting a bone marrow transplant, they would have to kill all my own bone marrow first. So I go through chemotherapy.
You can do it for cancer as well.
That's where people think that this is blood cancer, but it isn't, right? So I get chemotherapy. Chemotherapy, what it does, it kills all my bone marrow. But it also kills my sperm, and it also kills my ovaries, and it also kills my white blood cells, and it also kills everything else.
So your hair.
And I may lose my hair and everything else. And then once that chemotherapy is done, then they transplant that bone marrow. So the success rate in Pakistan, even outside in the best places, about 80 to 85%.
And probably it's also bone marrow transplant would also need some kind of matching genes as
Yes,
well.
so you would
Which
need
is also rare.
HLA matching, and that's typically a brother or a sister actually donates their bone marrow for that child. Just before the questions, I promised I'll leave 6 minutes for questions. that means, what this means is that if you have bone marrow transplant, you can cure it, but what you can also, what it means is that 1 in 5 children may not survive the bone marrow transplant, so it's not without risk. The latest therapy which they're doing is genetic editing. So what we know is that we know there's a chromosome, there's a AGCT. We know that these are the molecules which make up the DNA, right? What they do is, well, if I know on chromosome 11 at exactly this place, that's the defective gene, well, I'll send in something, it will cut this out, put in the right gene, and the patient will be fine. And so now they're doing that. And so they do genetic editing, and that is considered as a cure for thalassemia as well. The expense, last point here, is about 35 lakh rupees if you have an HLA matched individual to donate bone marrow transplant. And this is about approximately 1 crore to get genetic editing currently. Any questions?
Let's
Here.
let's suppose you do get the bone marrow transplant. Would you be able to have kids after that?
No. There's a likelihood that you may remain sterile. In the West, what they used to do is actually harvest the eggs prior to going through chemotherapy, or actually freeze them in liquid nitrogen, so that they can be used later on. Question?
Are these both chemotherapy and gene editing widely available across Pakistan?
Bone marrow transplant is available in 4 centers across Pakistan. In Karachi at the Khan University, in Lahore at Children's Hospital, in Islamabad at AFIBT, that's Armed Forces Institute of Bone Marrow Transplant, and as well as PIMS, Pakistan Institute of Medical Sciences.
Is thalassemia also common in like the West and like other areas?
Yes, because what I was talking about, the global village and people moving a lot, so there's a lot of Chinese and Pakistani Indians now in the West, and they bring their diseases there as well, which are specifically genetic. So it's all across now.
It's basically like the disease is migrating.
Yeah.
When you provide blood to the thalassemia patient, do you have to do it every week, every month?
So depending upon their age and their requirement, when they're small, they may need just 1 blood transfusion every month. But as they grow taller and bigger, like you and me, right, they may need about 4 to 5 bags of blood in a month.
So that is a temporary solution. The gene editing is a permanent solution.
Yes, to some extent.
Is there any risk in the gene editing?
Yes, because they also go through some amount of, not as strong chemotherapy, but some amount of chemotherapy.
You said that mostly their brothers and sisters donate the bone marrow.
Yes.
So what if they're like a thalassemia carrier, and so won't that affect their
No.
bone therapy?
No, because what maximum will happen, they'll become a thalassemia carrier as well. But they'll be disease-free. Please stop me when it's time.
Sure, sir.
If they're the only child, can they find a bone marrow transplant?
So in some cases, the mother can actually donate her bone marrow for that child, but then there's a higher risk of failure.
Is it going to affect the donor of bone marrow?
No, not at all. It does not affect the donor cell. One last most important message before I finish here. Donate blood. Volunteer blood donation. It's not going to affect your body. Yeah, your own blood is going to, anyways, disappear from your body in 120 days. The life cycle is 120 days, right? The biggest problem is we don't donate blood. हम डरते हैं कमजोर हो जाएंगे ये हो जाएगा वो हो
People
जाएगा
overdo it. They keep donating blood. That's why it causes a negative effect in their body. That's
well
what people don't.
every 4 months you can donate blood and forget about every 4 months if you just donate if everyone just promises that next time on my birthday I'm just going to donate blood just once a year on your birthday just donate blood it'll make a tremendous difference for everyone. Yeah.
Sir, since people have different blood types, right?
Yeah.
So thalassemia patients, like, if you want to like donate blood to someone like with thalassemia, then like, do you have to have the same type of blood as that person?
Yeah, so if the thalassemia is O positive, then I can donate my O positive blood.
But like I heard, like if you have like if I believe O negative thing is like given to like it can be given to like any blood.
Yes, but it's given to anyone. It's a universal donor, but it's given to anyone only in situations because one, we know it's major blood groups, and there's a lot of minor blood groups as well.
There's like
Which we
there's
don't
this
necessarily test for.
small blood group called like people with gold blood. Only 24% of people have it.
Yeah.
Basically, like they can give their blood to anyone.
If you donate blood, so there are chances of transferring the
No.
thalassemia.
No. If I'm thalassemic and I donate blood, which maybe I shouldn't, and nobody would take my blood, but it's not gonna transfer the disease to anyone. It isn't.
It's the genes that
It's
transfer.
the genes that transfer.
So could we now conclude the session?
I'm done.
Thank you.
Thank you.